washing with soap and water is more effective because it kills bacteria that would linger on the skin that Germ-X would not be able to get. It also is more effective with diseases like the flu or COVID-19 that's going around right now. Studies say that hand washing is a better technique for killing the germs that are left on your skin from debris around you and in the air. So, alright, this is my incision with my suture line right here on my patient. I have privacy with curtains up, and my patient's name is Jabbar Jones. His date of birth is 08/25/1963. He's in room 2040, and he is allergic to penicillin. So I'm actually going to have paper towels because I don't have gauze, and I'm actually going to stuff the thing with 2 of those and cover it with the ABS covering that I've also made up with paper towels, and I'm going to remove it so I can perform my wet to dry dressing. So, alright. So this is the covering with the paper towels in it. So I'm going to remove the ABS covering and throw it away in the trash. And also discard of the gauze that I have. So now when looking at the injury, there is redness and puffiness around the injury site. There is heat to the touch, as well as a strong odor and a yellow discharge that's coming out of it. So leads me to think that it's time for us to change the dressing, and there could be some kind of bacteria setting in with the dressing. So it's good that I'm cleaning it now. So it's definitely time for us to clean it. So now I'm going to take a gauze and I'm going to wet it with my solution. So this is a solution and expires 05/23, checking that. And I'm going to wet it and pat around the incision and pat in it to make sure that I get rid of what I can from the other gauze that I have just replaced. So patting it and maybe around it just to make sure that it is clean and thrown away. Now I'm going to take my other gauze and I'm going to dry it so that it is ready. So now I'm going to dispose of it. And I don't have a kit, so these are my gauze right here, my forceps and my tape, and this is my solution right here. So my saline solution actually expires 05/23, and I'm going to palm it by the label and pour it into these small cups that I am using as a basin so I can wet my gauze and get the most effect out of it.
Your hands are open. So you can come up with a script, okay?
There we go, making sure my cap is not touching at all.
So I guess will this be the tattoo guy?
Actually, I messed up and I spilled it on my table.
What's our script?
Alright, so now I'm going to get back on my gloves. So this is me cleaning it again. So here we go, touching my skin, getting inside, making sure there's no debris or anything like that. I'm trying not to splash this sterile field with anything either. Alright. So now I'm going to
I don't know. How much? Is it black card?
Alright, so now I'm going to wet my gauze and get out the excessive fluid in it so it does not soak anything, and pack them in.
Pretty small.
Here we go, keep packing it in.
How small?
Getting rid of the excess fluid. Just making sure it's really good and saturated so I can put it in the dressing. Okay, and now I'm going to take my ABS covering right here. I'm going to take it to the surface. Taking it down so I know it won't come off.
How much for a sleeve?
There we
I don't know, how much is a black card? I don't know.
And I'm going to write down the date and the time, so.
Hey, what's the date?
18th.
And what time is it?
It's now the 19th. And it's 1:54 on the 19th. That's not small. Well, it's not a lot of detail.
Alright, so I wrote down the date and the time to signal to the next nurse on the next shift that I changed it at this time, so within within a couple hours, when it's like 8 to 10 or 8 to 12 hours, that it is now time for them to change the dressing at this point. So they will know that it's not too soon, and that they're not already doing that ahead of schedule. So I'm going to remove my gloves, and I'm going to reposition my patient so that they're comfortable on the bed at a 90-degree angle so that they will not be sliding and during their wound, and keep it where it will not open up. I'm sorry, keeping it at like more of like a 40 or 45 between a 90-degree angle, just depending on what else they have wrong with them. Just to keep them from reopening their wound. Okay, so I'm actually going to document some times when I came in here. This is my water form right here. It's actually kind of wet, but so at normal saline, wait to dry dressing, change to hip every 4 hours. So it needs to be every 4 hours, so they'll know by 5:54 a.m. that it needs to be changed again. And also to take like their daily weights and stuff as they come in to do it, and just seeing like what kind of medication they're on at the time. Also, so now I'm going to just pick my supplies back up. My supplies was emptied into the garbage can at every point in time, and I also kept my hands above the sterile field. I tried to at each time until the end, but
Alright,
So with the wet, it felt a lot better on the patient because the procedure, it wasn't tearing away the skin. But when first performing the procedure, it would tear away the debris and stuff that had covered and
alright,
just
so
taking away that and debris so that the granulated tissue would be able to surface and rebuild itself from the injury, also causing it to heal better and to also cause like keep from bacteria from growing and there being an infection forming in the skin. So
Okay. So, alright, so you record me. Just have me
but
know
this
when
was
to
the suture line right here, and then this was the wound, and as you can see, it's been taped down with the covering, with the skin tape, and
do videos,
here we go.
and
So
then like,
thank you.